Well, Fox Carolina is the school station. A new study finding the mental health of many college students suffering due to relocating and other changes caused by the COVID-19 pandemic. Christine McCarthy has more.
If the coronavirus pandemic weren't stressful enough for everyone, being forced to relocate unexpectedly can be especially distressing. It's what many college students have dealt with as COVID-19 began shutting down campuses last March.
The mere fact of needing to move from where you live is something that can affect you mentally.
Dr. Cindy Liu, clinical psychologist at Brigham and Women's Hospital, is one of the researchers who studied the psychological effects of this displacement by surveying nearly 800 students between last April and August.
About a third of the participants in our study were asked to leave campus and to move off of campus. And that those who had to relocate showed higher rates of mental health problems.
Those problems include depression, anxiety, loneliness, and COVID-related worry and grief. A lack of access to social support and mental health resources compound those issues. One major stressor was leaving behind personal belongings.
We think about items that are important to us. It could be things like medication that really have a huge effect on how well we do. We had students who were studying abroad and couldn't get back to campus, and yet their items were removed without them being there.
For many students, a lack of communication from their schools and clarity on when they could return heightened their distress. Liu says the findings published in the Journal of Psychiatric Research should inform colleges of the impact of displacement and the need for ample support.
We hope that there will not be another major outbreak, but that is to be determined. While we do want to mitigate contagion, we also have to acknowledge the mental health consequences of our decisions.
Researchers will continue to follow students to see what long-term effects this displacement may have on them.